Hello medicos, today I am going to demonstrate you how PEEP looks like in real lungs. Here this glove will work as a alveolar. So what is PEEP? PEEP is positive and expiratory pressure. As name suggests, it is a positive pressure stays in lung after the expiration. Okay, now what happens is in normal condition when you breathe out, the some amount of volume kept in your lungs, okay, which keeps your alveolar open. But in some disease condition, your alveolar wall might become weak and it might get collapse. To prevent that, we use PEEP setting in ventilation. Okay, now let's see how different PEEP looks like in real life. Okay, currently this is on PEEP 2. Okay, so as you can see, there is some volume is still in there. Okay, it's expiration. Okay, inspiration, expiration. So even after expiration, some amount of volume is still stays in these gloves. Okay, so now let's increase the PEEP. Currently PEEP is 5. As you can see, the volume is increased. Okay, now its PEEP is on 8. So as you can see, when we increase the PEEP, the amount of volume left in the lung after expiration is increased. Okay, now let's set PEEP on 10. Now as you can see, PEEP is now 10. The amount of air stays in the lung after expiration has been increased, right? Now let's set PEEP on 15. Okay, so as you can see, when we increase the PEEP, the amount stays in the lung increase, okay, which keeps your alveolar open. Condition like ARDS, cardiogenic pulmonary edema, we have to set PEEP on a higher side. Okay, so because in these conditions there are more chances that alveolar might get collapse. Okay, so we set PEEP around 8 to 15. Okay, now, in conditions such as COPD and asthma, what happens is air is already being trapped in alveolar. So we can't set PEEP on high because it may get worse. Okay, so in such condition like COPD and asthma, we set PEEP as low as possible. Okay, hope this video helps you.